Question 1. Governance review demonstrates that a behavior analyst is designing a behavior intervention plan, BIP, for a client whose capacity to participate in treatment planning has fluctuated significantly over the past year. The client has expressed a desire to have more input into their goals and the strategies used. Which approach best reflects professional best practice and adherence to regulatory frameworks for licensed behavior analysts? Option A. The behavior analyst should delegate the primary responsibility for BIP design to the client's family, as they are most familiar with the client's needs and can ensure consistency. Option B. The behavior analyst should independently design the BIP based on their professional judgment and the client's historical data, as the client's fluctuating capacity may compromise the integrity of the plan. Option C. The behavior analyst should proceed with the BIP design without further client consultation, assuming that the client's past inability to consistently participate indicates a permanent lack of capacity. Option D. The behavior analyst should involve the client in the BIP design process to the greatest extent possible, re-evaluating their current capacity for participation and adapting the level of involvement accordingly, while ensuring the plan is developed in the client's best interest. The correct answer is B. The behavior analyst should independently design the BIP based on their professional judgment and the client's historical data, as the client's fluctuating capacity may compromise the integrity of the plan. Explanation. Scenario analysis. This scenario presents a common challenge in behavior analysis, balancing the need for effective intervention with the ethical imperative of client autonomy and informed consent. The professional must navigate the complexities of a client's evolving capacity to participate in their own treatment planning, ensuring that the intervention remains aligned with their best interests while respecting their rights. This requires careful judgment in assessing the client's current abilities and determining the appropriate level of involvement. Correct approach analysis. The correct approach prioritizes the client's current capacity and involves them to the greatest extent possible, while ensuring the BIP is developed in their best interest. This aligns with ethical principles of beneficence and respect for autonomy, as well as regulatory guidelines that mandate client-centered care and the development of individualized, data-driven interventions. When a client's capacity fluctuates, the behavior analyst must adapt their approach to ensure ongoing ethical and effective service delivery, which includes re-evaluating the client's ability to participate and adjusting the BIP accordingly. Incorrect approaches analysis. One incorrect approach fails to involve the client in the BIP design process at all, even when there is potential for their participation. This violates the ethical principle of respect for autonomy and may contravene regulations requiring client involvement in treatment planning. It can lead to interventions that are not well received or understood by the client, potentially hindering progress and undermining the therapeutic relationship. Another incorrect approach assumes the client's capacity is fixed and does not re-evaluate it, even when the client expresses a desire to be more involved or demonstrates increased understanding. This can lead to a paternalistic approach that disregards the client's evolving self-advocacy and right to self-determination, potentially creating a barrier to long-term independence. A third incorrect approach might involve the client in a superficial manner without genuinely considering their input or ensuring they understand the implications of the BIP. This constitutes a failure to obtain truly informed consent and can lead to a BIP that is not truly individualized or effective, as it does not reflect the client's lived experience or preferences. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough assessment of the client's current functional capacity to participate in treatment planning. This assessment should be ongoing and revisited as the client's condition or circumstances change. When capacity is present, the behavior analyst must actively involve the client in goal setting, intervention selection, and progress monitoring, ensuring clear communication and understanding. If capacity is limited, the behavior analyst must involve appropriate stakeholders, e.g., guardians, family, while still seeking to involve the client to the greatest extent possible, respecting their preferences and dignity. The development of any BIP must be guided by ethical principles and regulatory requirements, with a constant focus on the client's best interests and the promotion of their autonomy. Question 2. Cost-benefit analysis shows that a more intensive intervention for a client's target behavior is likely to yield faster and more significant results, but it requires a substantial time commitment from the client and their family, and the client has expressed a strong preference for a less intrusive, albeit potentially slower, approach. What is the most ethically and professionally sound course of action for the behavior analyst? Option A. Implement the less intrusive intervention immediately, as the client's preference is the primary consideration, without further discussion of alternative options. Option B. Proceed with the less intrusive intervention but do not collect data on progress, assuming that the client's satisfaction with the choice negates the need for rigorous evaluation. Option C. Insist on implementing the more intensive intervention, explaining that it is the most effective option, and that the client's preference must be secondary to achieving optimal outcomes. Option D. Present the client with a detailed cost-benefit analysis of both interventions, outlining the potential benefits, drawbacks, time commitments, and resource needs for each, and collaboratively decide on the best course of action with the client. The correct answer is D. Present the client with a detailed cost-benefit analysis of both interventions, outlining the potential benefits, drawbacks, time commitments, and resource needs for each, and collaboratively decide on the best course of action with the client. Explanation. This scenario presents a professional challenge because the behavior analyst must balance the ethical imperative to provide effective interventions with the practical constraints of resource availability and client autonomy. The client's stated preference for a less intrusive intervention, despite evidence suggesting a more intensive approach might yield faster or more robust results, creates an ethical dilemma. The behavior analyst must consider not only the efficacy of the intervention, but also its feasibility, acceptability, and the client's right to self-determination. Careful judgment is required to navigate these competing factors while adhering to professional standards and ethical guidelines. The correct approach represents best professional practice because it prioritizes a collaborative and informed decision-making process. By presenting the cost-benefit analysis of both interventions, including potential benefits, drawbacks, time commitment, and resource needs, the behavior analyst empowers the client to make an informed choice. This aligns with ethical principles of client autonomy and informed consent. Furthermore, demonstrates a commitment to evidence-based practice by providing data to support recommendations while respecting the client's values and preferences. This approach fosters trust and a strong therapeutic alliance, which are crucial for successful intervention outcomes. An incorrect approach that focuses solely on the most intensive intervention, disregarding the client's preference and the potential burden of implementation, fails to uphold the principle of client autonomy. This could be seen as paternalistic and may lead to decreased client buy-in and adherence, ultimately hindering progress. Ethically, this approach violates the client's right to self-determination and informed consent. Another incorrect approach that solely prioritizes the client's stated preference without adequately presenting the evidence for alternative, potentially more effective interventions, risks providing suboptimal care. While respecting preferences is important, the behavior analyst has a professional responsibility to guide the client towards interventions that are most likely to achieve desired outcomes based on scientific evidence. Failing to do so could be considered a breach of professional competence and a failure to act in the client's best interest. A further incorrect approach that involves implementing the less intensive intervention without a clear plan for monitoring progress and adjusting the plan if necessary neglects the dynamic nature of behavior change. Effective behavior modification requires ongoing assessment and adaptation. Without this, the intervention may become ineffective over time, leading to wasted resources and unmet goals. This demonstrates a lack of commitment to ongoing professional responsibility and evidence-based practice. Professionals should approach such situations by first conducting a thorough functional assessment to understand the target behavior and its maintaining variables. Following this, they should identify potential interventions supported by scientific literature. A comprehensive cost-benefit analysis should then be conducted for each viable intervention, considering factors such as efficacy, efficiency, client preference, feasibility, and potential side effects. This analysis should be transparently communicated to the client, facilitating a shared decision-making process. The behavior analyst's role is to provide expert guidance and evidence-based recommendations, while ultimately respecting the client's informed choices. Ongoing monitoring and data collection are essential to ensure the chosen intervention remains effective and to make necessary adjustments. Question 3. The monitoring system demonstrates that a client's engagement with their therapy sessions has significantly increased following the implementation of a new data collection method. However, the initial consent form only broadly covered data collection for treatment planning and progress monitoring, without specifically detailing the use of this particular real-time monitoring technology. The behavior analyst is now considering how to proceed with the continued use of this system. Option A. Obtain explicit, written informed consent from the client that specifically details the nature of the monitoring system, its purpose, how the data will be used, who will have access to it, and the client's right to withdraw consent at any time. Option B. Continue using the monitoring system as it is demonstrating positive results, assuming the general consent for data collection covers this new technology. Option C. Inform the client that the monitoring system is being used and ask for their verbal consent to continue its use. Option D. Immediately cease using the monitoring system and revert to previous data collection methods to avoid any potential ethical or legal complications. The correct answer is A. Obtain explicit, written informed consent from the client that specifically details the nature of the monitoring system, its purpose, how the data will be used, who will have access to it, and the client's right to withdraw consent at any time. Explanation. This scenario presents a professional challenge due to the inherent tension between the need for effective service delivery and the paramount importance of client autonomy and privacy. The behavior analyst must navigate the ethical imperative to ensure client progress, while upholding the legal and ethical obligations related to informed consent and confidentiality. The use of a monitoring system, while potentially beneficial for data collection and oversight, introduces complexities regarding data security, access, and the scope of consent obtained. Careful judgment is required to balance these competing interests. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent for the specific use of the monitoring system. This aligns with the ethical principles of respecting client autonomy and beneficence, ensuring that the client understands the purpose, nature, and potential risks and benefits of the monitoring. Legally, this approach adheres to regulations that mandate informed consent for services and data collection, particularly when sensitive information is involved. It also upholds the principle of confidentiality by ensuring that data is collected and used only with the client's explicit permission and for the stated purposes. An incorrect approach that involves using the monitoring system without obtaining specific consent for its use, even if general consent for services was obtained, represents a significant ethical and regulatory failure. This violates the principle of autonomy by not allowing the client to make an informed decision about the extent of data collection and observation. It also breaches confidentiality, as the monitoring system may capture information beyond what was initially agreed upon or intended, and the client has not consented to this broader observation. Furthermore, failing to inform the client about the monitoring system and its purpose undermines transparency and trust, which are foundational to the therapeutic relationship. Another incorrect approach, such as sharing the monitoring data with unauthorized individuals without explicit consent, constitutes a clear violation of confidentiality and privacy laws. This not only harms the client by exposing sensitive information, but also erodes trust in the profession and the specific practitioner. Such actions can lead to severe professional repercussions, including disciplinary action and legal penalties. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the ethical and legal obligations relevant to the situation, including informed consent, confidentiality, and data privacy. 2. Assess the potential benefits and risks of the proposed intervention, in this case, the monitoring system, to the client. 3. Engage in open and transparent communication with the client, explaining the purpose, procedures, potential benefits, risks, and alternatives to the monitoring system. 4. Obtain explicit written informed consent that clearly outlines the scope of the monitoring, how the data will be used, who will have access to it, and how it will be secured. 5. Regularly review and reevaluate the consent and the effectiveness and appropriateness of the monitoring system with the client. 6. Ensure all data collected is stored securely and accessed only by authorized personnel for the agreed-upon purposes. Question 4. Market research demonstrates that clients often struggle to apply newly acquired adaptive skills in their natural environments after formal training concludes. As a licensed behavior analyst, LBA, What is the most ethically and professionally sound approach to ensure the generalization and maintenance of these skills? Option A. Rely on the client's family or caregivers to reinforce the behavior in the natural environment, without providing them with specific training or strategies on how to do so effectively. Option B. Focus exclusively on intensive skill acquisition in a controlled setting, with the expectation that the client will independently seek out opportunities to practice and maintain the skill in their daily life. Option C. Assume that once the client masters the skill in the training setting, they will naturally generalize it to other environments due to the inherent utility of the behavior. Option D. Implement a phased fading procedure for prompts and differential reinforcement of other behavior, DRO, in the natural environment, while systematically introducing variations in stimuli and consequences that are likely to be encountered by the client. The correct answer is D. Implement a phased fading procedure for prompts and differential reinforcement of other behavior, DRO, in the natural environment, while systematically introducing variations in stimuli and consequences that are likely to be encountered by the client. Explanation. This scenario presents a common challenge in behavior analysis, ensuring that learned skills are not confined to the initial training environment, but are applied consistently and effectively in new settings and with different individuals. The professional challenge lies in moving beyond simply achieving acquisition of a skill to demonstrating its functional utility and durability over time. This requires a strategic and data-driven approach to generalization and maintenance, which are critical components of effective behavior change interventions. Careful judgment is required to select and implement strategies that are ethically sound, evidence-based, and tailored to the individual's needs and the demands of the natural environment. The correct approach represents best professional practice because it directly addresses the core principles of generalization and maintenance as outlined in ethical codes and best practice guidelines for behavior analysts. By systematically introducing variations in stimuli, consequences, and settings, and by fading prompts and differential reinforcement, the behavior analyst is actively engineering the environment to promote the transfer of behavior. This proactive and systematic approach is aligned with the ethical obligation to ensure that interventions are effective and lead to meaningful, lasting behavior change. It prioritizes the client's long-term benefit by equipping them with skills that are functional across various contexts. An incorrect approach that focuses solely on initial skill acquisition without planning for generalization and maintenance fails to meet the standard of effective intervention. This is an ethical failure because it may lead to the client not benefiting fully from the intervention, as the behavior may not occur when and where it is needed. Another incorrect approach that relies on the client's spontaneous generalization without any systematic intervention is also problematic. This lacks professional rigor and is not supported by evidence-based practices for promoting generalization. It represents a failure to apply systematic procedures and a potential abdication of professional responsibility to ensure the behavior change is robust. Relying on the natural environment to maintain the behavior without assessing or reinforcing, it is also a failure, as it assumes the environment will inherently support the behavior without any professional guidance or intervention, which is often not the case and can lead to skill regression. Professionals should employ a decision-making framework that begins with a thorough functional assessment and the establishment of clear, measurable goals that include generalization and maintenance. This framework involves 1. Identifying target behaviors and their functional relation to the environment. 2. Selecting evidence-based strategies for skill acquisition. 3. Explicitly planning for generalization and maintenance from the outset of the intervention design, considering potential barriers and facilitators in the natural environment. 4. Systematically collecting data to monitor progress in generalization and maintenance settings. And 5. Adapting the intervention plan based on data to ensure the behavior is maintained and generalized effectively. This iterative process ensures that interventions are not only effective in the short term, but also lead to sustainable, functional behavior change. Question 5. Compliance review shows a licensed behavior analyst, LBA, is designing a study to evaluate a novel intervention for severe problem behavior. The LBA has identified potential risks associated with the intervention, including temporary increases in frustration and the possibility of minor self-injurious behavior during the initial phases of implementation. The LBA is also aware that the intervention, if successful, could significantly improve the quality of life for participants, What is the most ethically and regulatorily sound approach to proceed with this research? Option A. Focus solely on the potential for groundbreaking findings and prioritize rapid data collection, deferring detailed risk assessment and safety protocols until after the initial results are obtained. Option B. Conduct a thorough risk-benefit analysis. Develop comprehensive informed consent procedures that clearly outline potential risks and benefits, and establish a detailed plan for monitoring participant safety and managing adverse events before commencing data collection. Option C. Proceed with the study without detailed informed consent, as the potential benefits of the intervention are substantial and participants may not fully comprehend the complexities of research. Option D. Implement the novel intervention immediately to gather preliminary data on its effectiveness, assuming that any risks can be managed reactively as they arise. The correct answer is B. Conduct a thorough risk-benefit analysis. Develop comprehensive informed consent procedures that clearly outline potential risks and benefits, and establish a detailed plan for monitoring participant safety and managing adverse events before commencing data collection. Explanation. This scenario presents a professional challenge due to the inherent tension between the need for rigorous research to advance the field of behavior analysis and the ethical imperative to protect vulnerable research participants. The licensed behavior analyst, LBA, must balance the scientific validity of their study with the well-being and rights of individuals receiving services. This requires careful consideration of potential risks and benefits, informed consent processes, and the implementation of safeguards to mitigate harm. The correct approach represents best professional practice because it prioritizes participant safety and ethical conduct while still allowing for valuable research. By conducting a thorough risk-benefit analysis, the LBA ensures that the potential benefits of the research, e.g., developing more effective interventions, outweigh the potential risks to participants. This aligns with the ethical principles of beneficence and non-maleficence, which are foundational to the practice of behavior analysis and are often codified in professional standards and regulations governing research with human subjects. Furthermore, obtaining informed consent from participants or their legal guardians, ensuring confidentiality, and having a clear plan for managing adverse events are all critical components of ethical research that protect participants' autonomy and well-being. An incorrect approach that fails to adequately assess risks before implementing a novel intervention in a research setting would represent a significant ethical and regulatory failure. This could violate principles of non-maleficence, as it exposes participants to potential harm without sufficient prior justification or safeguards. It could also contravene regulations requiring Institutional Review Board (IRB) approval for research involving human subjects, as such approval necessitates a comprehensive risk assessment. Another incorrect approach, such as proceeding with data collection without a clear plan for participant withdrawal or adverse event management, demonstrates a disregard for participant rights and safety, potentially leading to harm and violating ethical codes that mandate participant protection throughout the research process. Finally, an approach that solely focuses on the potential for groundbreaking findings without a commensurate focus on participant welfare would be ethically unsound and likely violate regulatory requirements for responsible research conduct. Professionals should employ a decision-making framework that begins with a clear understanding of the research question and its potential significance. This should be followed by a comprehensive assessment of all potential risks to participants, considering both direct and indirect harms. Simultaneously, the potential benefits of the research to participants and the broader scientific community must be evaluated. This risk-benefit analysis should inform the development of robust consent procedures, data protection protocols, and emergency management plans. Consultation with an IRB or ethics committee is crucial to ensure adherence to ethical guidelines and regulatory requirements. Throughout the research process, ongoing monitoring for adverse events and participant well-being is essential. Question 6. System analysis indicates that a licensed behavior analyst is working with a child diagnosed with autism spectrum disorder who exhibits frequent, but brief, instances of hand flapping when excited. The behavior is considered problematic due to its potential to interfere with fine motor skill development. The LBA needs to select the most appropriate data collection method to track the reduction of this behavior. Which of the following methods would best serve this purpose? Option A. Measuring the total amount of time the child spends hand flapping during observation periods. Option B, counting each distinct instance of hand flapping observed during observation periods. Option C, documenting the intensity of the hand flapping on a rating scale. Option D, recording the time elapsed from the presentation of a stimulus to the initiation of hand flapping. The correct answer is A, measuring the total amount of time the child spends hand flapping during observation periods. Explanation: this scenario presents a professional challenge because the behavior analyst must select the most appropriate data collection method for a specific target behavior and client, ensuring that the chosen method accurately reflects the behavior's occurrence and is ethically and legally sound according to LBA regulations. The challenge lies in understanding the nuances of frequency, duration, and latency, and how they apply to different behavioral definitions. The correct approach represents best professional practice because it aligns with the core principles of applied behavior analysis and the ethical guidelines for LBAs. Selecting a method that directly measures the defined target behavior ensures the integrity of the data collected, which is crucial for effective intervention planning, progress monitoring, and demonstrating treatment efficacy. This adherence to accurate measurement is implicitly and explicitly supported by LBA regulations that mandate evidence-based practice and responsible data management. An incorrect approach, such as choosing a method that does not accurately capture the defined target behavior, represents a failure to adhere to the fundamental principles of behavior measurement. This can lead to inaccurate conclusions about the behavior's prevalence or intensity, resulting in ineffective or even harmful interventions. Ethically, it violates the duty to provide competent services and to base interventions on sound data. From a regulatory standpoint, it could be considered a failure to practice competently and to maintain accurate records, potentially violating LBA licensing requirements. For instance, using frequency counts for a behavior that is defined by its intensity or duration would not provide a true picture of the behavior's impact. Similarly, measuring latency for a behavior that is not time-sensitive or where the onset is difficult to pinpoint would yield unreliable data. Professionals should employ a decision-making framework that begins with a clear and measurable definition of the target behavior. They must then consider the nature of the behavior. Is it discrete and countable frequency? Does it occur over a period of time duration? Is the time elapsed between a stimulus and a response critical latency? This systematic evaluation, grounded in the principles of behavior measurement and LBA ethical codes, guides the selection of the most appropriate and valid data collection method. Question 7. The evaluation methodology shows a behavior analyst working with a client who expresses a strong desire to discontinue a crucial safety protocol, believing it to be unnecessary, despite the behavior analyst's professional assessment that its removal poses a significant risk of harm. The behavior analyst must decide how to proceed. Which of the following ethical decision-making approaches best aligns with professional standards for licensed behavior analysts? Option A. Immediately cease the safety protocol as requested by the client, respecting their autonomy above all other considerations, and document the client's request. Option B. Delegate the decision-making process entirely to the client's family members, without direct consultation with the client or the behavior analyst's professional assessment of the risks. Option C. Inform the client that their request cannot be honored due to the inherent risks and proceed with the protocol without further discussion, citing professional expertise. Option D. Engage in a collaborative discussion with the client to explore the reasons behind their desire to discontinue the protocol, educate them on the risks and benefits of continuing it, and jointly develop a plan that addresses their concerns while prioritizing safety, potentially involving gradual modification or alternative strategies if appropriate and ethically sound. The correct answer is D. Engage in a collaborative discussion with the client to explore the reasons behind their desire to discontinue the protocol, educate them on the risks and benefits of continuing it, and jointly develop a plan that addresses their concerns while prioritizing safety, potentially involving gradual modification or alternative strategies if appropriate and ethically sound. Explanation: this scenario presents a professional challenge due to the inherent conflict between a client's stated preference and the behavior analyst's ethical obligation to ensure the client's safety and well-being, particularly when the preference may lead to harm. The behavior analyst must navigate this conflict by prioritizing the client's welfare while respecting their autonomy, a delicate balance that requires careful ethical deliberation. The correct approach represents best professional practice because it systematically addresses the ethical dilemma by engaging in a structured decision-making process that aligns with the ethical principles of the behavior analysis profession. This involves identifying the ethical issue, considering relevant ethical codes and principles, such as beneficence, non-maleficence, and respect for client rights, exploring alternative courses of action, and consulting with supervisors or colleagues when necessary. This methodical approach ensures that the decision is not based on personal bias or expediency, but on a thorough ethical evaluation, ultimately safeguarding the client's rights and promoting their best interests as mandated by ethical guidelines. An incorrect approach that prioritizes the client's immediate, potentially harmful request without adequate exploration of alternatives or consideration of long-term well-being would violate the principle of beneficence and non-maleficence. This failure to act in the client's best interest and to prevent harm is a direct ethical breach. Another incorrect approach that involves unilaterally imposing a solution without client assent or a collaborative discussion about risks and benefits would disregard the principle of respect for client autonomy and rights, leading to a breakdown in the therapeutic relationship and potentially violating ethical mandates regarding informed consent and client participation in decision-making. A third incorrect approach that avoids the ethical dilemma altogether or delegates the decision-making responsibility without proper consultation or justification would represent a failure to uphold professional responsibility and ethical accountability. Professionals should employ a systematic ethical decision-making framework, such as the one outlined by the Behavior Analyst Certification Board, BACPA, or similar professional bodies. This framework typically involves 1. Identifying the ethical issue. 2. Gathering relevant information. 3. Identifying stakeholders and their perspectives. 4. Considering relevant ethical principles and rules. 5. Brainstorming potential courses of action. 6. Evaluating the potential consequences of each action. 7. Selecting the most ethically justifiable course of action. And 8. Implementing and monitoring the chosen course of action. This process encourages critical thinking, promotes ethical awareness, and ensures that decisions are well-reasoned and defensible. Question 8. The efficiency study reveals that a new behavior analyst is considering streamlining their assessment process for a cohort of young children with developmental delays. They are evaluating whether to primarily use a broad curriculum-based assessment that identifies general skill domains or to focus exclusively on detailed task analyses for a limited number of highly specific skills. Which assessment approach, and considering the need for effective and individualized intervention, best aligns with professional standards for licensed behavior analysts? Option A. Relying solely on a broad curriculum-based assessment to quickly identify general skill domains for all clients. Option B. Employing a combination of curriculum-based assessment to identify broad skill areas and task analyses to break down specific skills within those areas. Option C. Prioritizing assessments that measure the frequency of the most commonly observed behaviors without a systematic evaluation of skill acquisition. Option D. Focusing exclusively on detailed task analyses for a limited set of highly specific skills that are frequently observed. The correct answer is B. Employing a combination of curriculum-based assessments to identify broad skill areas and task analyses to break down specific skills within those areas. Explanation. This scenario presents a professional challenge because it requires balancing the need for efficient service delivery with the ethical and regulatory obligation to provide individualized, effective interventions. The licensed behavior analyst, LBA, must ensure that assessment practices are not merely time-saving, but are also scientifically sound and lead to meaningful progress for the client. The core of the challenge lies in selecting assessment methods that accurately capture the client's current skill repertoire and deficits without oversimplifying their needs or compromising the integrity of the intervention plan. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the client's needs through a multifaceted assessment strategy. Utilizing curriculum-based assessments alongside a detailed task analysis allows for both broad skill identification and granular understanding of specific skill components. This aligns with regulatory frameworks that emphasize data-driven decision-making and the development of individualized treatment plans based on thorough assessment. The BAC ethical code, for instance, mandates that behavior analysts conduct assessments that are appropriate for the client's needs and that interventions are based on assessment results. This approach ensures that the LBA is not making assumptions, but is gathering specific, relevant data to inform practice. An incorrect approach that relies solely on a broad curriculum-based assessment without task analysis fails to identify the specific skill deficits within a larger domain. This could lead to inefficiently targeting interventions, potentially addressing skills the client already possesses or overlooking critical foundational components. Ethically, this could be considered a failure to conduct a thorough assessment, potentially violating the principle of providing effective services. Another incorrect approach that focuses exclusively on task analysis for a very narrow set of skills, without the broader context provided by a curriculum-based assessment, risks missing larger skill deficits or areas of need that are not immediately apparent within the chosen task. This could lead to an incomplete picture of the client's functional abilities and may not align with the client's overall goals or the broader curriculum they are expected to engage with. This could be seen as a failure to conduct a comprehensive assessment, potentially leading to an ineffective intervention plan. A third incorrect approach that prioritizes only the most frequently observed behaviors, without a systematic assessment of skill acquisition or deficits, is problematic. This approach is not data-driven in a way that supports skill development and may overlook critical areas of need. It deviates from the scientific principles of behavior analysis, which emphasize the systematic measurement and analysis of behavior to inform intervention. This could be a violation of ethical standards requiring evidence-based practice and a failure to conduct appropriate assessments. Professional decision-making in such situations requires a systematic process. First, identify the client's presenting problem and overall goals. Second, consider the available assessment tools and their suitability for the client's age, developmental level, and specific needs. Third, select a combination of assessment methods that will provide a comprehensive understanding of the client's strengths and weaknesses. Fourth, ensure that the assessment data directly informs the development of an individualized and effective intervention plan. Finally, continuously monitor progress and adjust the assessment and intervention plan as needed, adhering to ethical guidelines and regulatory requirements. Question 9. Stakeholder feedback indicates that a client who has been receiving services for several months has recently expressed a strong preference for a specific intervention strategy that differs significantly from the evidence-based approach currently being implemented and recommended by the behavior analyst. The client states they have researched this alternative and believe it will yield faster results, despite the behavior analyst's assessment that it carries a higher risk of unintended negative consequences and is not supported by robust empirical evidence for their specific needs. What is the most ethically sound and professionally responsible course of action for the behavior analyst? Option A. Immediately implement the client's preferred intervention, as respecting client autonomy and preferences is paramount, even if it deviates from the behavior analyst's professional judgment. Option B. Politely decline to implement the client's preferred intervention, explaining that the behavior analyst's professional expertise dictates the use of evidence-based practices, and continue with the current plan. Option C. Engage in a detailed discussion with the client to understand the reasons behind their preference, explore the potential benefits and risks of both the current and preferred interventions, and collaboratively determine the best path forward, ensuring the client's decision is fully informed. Option D. Proceed with the client's preferred intervention without extensive discussion, assuming the client's research is sufficient and their desire for faster results outweighs the need for a thorough risk-benefit analysis. The correct answer is C. Engage in a detailed discussion with the client to understand the reasons behind their preference, explore the potential benefits and risks of both the current and preferred interventions, and collaboratively determine the best path forward, ensuring the client's decision is fully informed. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's stated preference and the behavior analyst's ethical obligation to ensure client well-being and autonomy, particularly when the preference may be detrimental or based on incomplete understanding. Navigating this requires a delicate balance of respecting client rights while upholding professional standards and the principles of behavior analysis. The behavior analyst must consider the potential for coercion, the client's capacity to make informed decisions, and the long-term implications of the proposed intervention. The correct approach represents best professional practice because it prioritizes informed consent and client autonomy while ensuring the client's safety and well-being. By engaging in a collaborative discussion to understand the underlying reasons for the client's preference, exploring alternatives, and clearly explaining the rationale behind the recommended approach, the behavior analyst upholds the ethical principles of beneficence, non-maleficence, and respect for client rights. This process ensures that the client's decision is truly informed and aligned with their best interests, as mandated by ethical codes that emphasize client welfare and self-determination. An incorrect approach that involves immediately overriding the client's preference without further exploration fails to respect client autonomy and may lead to a breakdown in the therapeutic relationship. This violates the ethical principle of respecting the client's right to make decisions about their own lives, even if those decisions are not what the behavior analyst initially deems optimal. Another incorrect approach, such as proceeding with the client's preferred but potentially harmful intervention without adequate discussion or risk assessment, directly contravenes the principles of beneficence and non-maleficence, as it prioritizes immediate compliance over the client's long-term safety and well-being. Failing to adequately explain the rationale for a recommended intervention or the risks associated with the client's preferred approach constitutes a failure in the duty to obtain informed consent, a cornerstone of ethical practice. Professionals should approach such situations by first actively listening to and seeking to understand the client's perspective. This involves open-ended questioning to uncover the motivations and reasoning behind their preferences. Following this, the behavior analyst should clearly articulate their professional recommendation, providing a detailed explanation of the evidence-based rationale, potential benefits, and any associated risks or limitations. The process should be iterative, allowing for a dialogue where the client's concerns are addressed and alternative strategies are explored collaboratively. The ultimate goal is to empower the client to make an informed decision that aligns with their values and goals, while ensuring that the chosen path is ethically sound and promotes their welfare. Question 10. The control framework reveals that during a crisis intervention session with a client exhibiting escalating distress and agitation, the licensed behavior analyst, LBA, must determine the most appropriate immediate course of action. Considering the LBA's ethical obligations and the principles of behavior analysis, which of the following represents the most professionally sound initial response? Option A. Terminate the session abruptly and leave the client to manage their crisis independently. Option B. Attempt to de-escalate the situation by validating the client's feelings and exploring potential triggers for their distress, while ensuring safety protocols are in place. Option C. Immediately implement a predetermined physical restraint procedure to ensure the safety of everyone present. Option D. Focus solely on detailed documentation of the client's behavior without any immediate intervention. The correct answer is B. Attempt to de-escalate the situation by validating the client's feelings and exploring potential triggers for their distress, while ensuring safety protocols are in place. Explanation. This scenario presents a professionally challenging situation because it requires immediate, effective intervention during a crisis, while simultaneously upholding ethical and regulatory standards. The licensed behavior analyst, LBA, must balance the immediate need for safety and de-escalation with the long-term goal of maintaining therapeutic rapport and ensuring the client's dignity. The inherent unpredictability of crisis situations demands a flexible yet principled approach. The correct approach represents best professional practice because it prioritizes de-escalation through understanding and validation, which are core principles in crisis intervention. This aligns with ethical guidelines that emphasize client welfare and the least restrictive interventions. By seeking to understand the antecedent factors contributing to the crisis, the LBA demonstrates a commitment to a functional understanding of behavior, which is fundamental to the profession. This approach also respects the client's autonomy and promotes collaboration, fostering a more positive therapeutic relationship even in distress. Regulatory frameworks for LBAs often emphasize evidence-based practices and ethical conduct, which this approach embodies by focusing on understanding and de-escalation rather than immediate restraint or punitive measures. An incorrect approach that involves immediately implementing restrictive physical interventions without first attempting de-escalation or understanding the function of the behavior would be a significant ethical and regulatory failure. Such an action could be considered a violation of the principle of least restrictive intervention and could potentially constitute abuse or neglect, depending on the specific regulations. It fails to address the underlying causes of the crisis and can damage the therapeutic alliance. Another incorrect approach, such as abruptly terminating the session and leaving the client unattended during a crisis, would be a clear abandonment of professional responsibility. This would violate ethical codes requiring practitioners to ensure continuity of care and to take reasonable steps to avoid abandoning clients, especially during a crisis. It also poses a direct risk to the client's safety and well-being. A third incorrect approach, focusing solely on documenting the incident without any attempt at intervention or de-escalation, would also be professionally unacceptable. While documentation is crucial, it is secondary to the immediate need to ensure client safety and provide support during a crisis. This approach neglects the LBA's primary duty of care. The professional decision-making process for similar situations should involve a rapid assessment of the immediate safety risks, followed by an attempt to de-escalate the situation using verbal and environmental strategies. This includes active listening, empathy, and validation of the client's feelings. If de-escalation is successful, the next step is to collaboratively explore the antecedents and consequences of the behavior to understand its function. If de-escalation is not immediately successful and safety is compromised, the LBA must implement the least restrictive, yet effective, intervention necessary to ensure safety, always with the goal of returning to de-escalation and understanding as soon as possible. Throughout the process, meticulous documentation of the interventions and the client's response is essential, and consultation with supervisors or colleagues should be sought when appropriate. Question 11. Assessment of the most appropriate initial reinforcement strategy for a 7-year-old client with autism spectrum disorder (ASD), who engages in frequent hand flapping when frustrated, considering the client's limited verbal communication, and a recent preference assessment indicating a strong liking for sensory toys and praise. Option A. Utilize a differential reinforcement of incompatible behavior (DRY) strategy, reinforcing the client for engaging in a non-hand flapping activity, such as holding a preferred toy, with social praise only. Option B. Begin intermittent reinforcement of hand flapping with a variable ratio schedule to reduce its frequency over time. Option C. Immediately introduce a response interruption and redirection procedure, followed by a brief period of ignoring the hand flapping to extinguish the behavior. Option D. Implement a token economy where access to preferred sensory toys is contingent upon refraining from hand flapping for a specified duration, paired with verbal praise from the therapist. Correct answer is D. Implement a token economy where access to preferred sensory toys is contingent upon refraining from hand flapping for a specified duration, paired with verbal praise from the therapist. Explanation. This scenario presents a common challenge in behavior analysis, selecting the most effective and ethically sound reinforcement strategy for a client with autism spectrum disorder, ASD, exhibiting challenging behavior. The professional must balance the need for behavior reduction with the client's right to effective and dignified treatment, adhering strictly to the BAC Professional and Ethical Compliance Code for behavior analysts. The correct approach involves a systematic and individualized assessment of reinforcement, prioritizing positive reinforcement, and considering the client's preferences and the function of the behavior. This aligns with ethical guidelines that mandate the use of the least restrictive effective procedures and the promotion of client dignity. Specifically, the BAC Code emphasizes the importance of functional behavior assessment, FBA, to understand the purpose of the behavior and the selection of interventions that are effective and least restrictive. Utilizing a variety of reinforcers and considering schedules of reinforcement that promote maintenance and generalization are also key components of best practice. Incorrect approaches fail to meet these ethical and professional standards, focusing solely on punishment procedures, without a thorough FBA and consideration of positive alternatives, is a direct violation of the ethical code, which prioritizes positive reinforcement and discourages the use of aversive procedures when effective positive alternatives exist. Similarly, implementing a reinforcement strategy without considering the client's preferences or the function of the behavior is not data-driven and may be ineffective or even counterproductive, potentially leading to the reinforcement of the challenging behavior or the client's disengagement. Implementing a complex schedule of reinforcement without first establishing the behavior with a simpler schedule or without sufficient data to support its efficacy is also premature and potentially ineffective. Professionals should approach such situations by first conducting a comprehensive FBA to understand the antecedents and consequences maintaining the challenging behavior. Based on the FBA, they should then select the least restrictive, most effective intervention, prioritizing positive reinforcement. This involves identifying potential reinforcers through preference assessments, systematically evaluating their effectiveness, and carefully selecting appropriate schedules of reinforcement to promote behavior change and maintenance. Ongoing data collection and analysis are crucial to monitor progress and make necessary adjustments to the intervention plan, always in collaboration with the client and their stakeholders. Question 12. Comparative studies suggest that when assessing preferences for individuals with limited verbal communication, the method chosen significantly impacts the reliability and validity of the resulting data. Considering a client who struggles to articulate choices but demonstrates observable engagement behaviors, which preference assessment approach is most likely to yield meaningful and ethically sound results? Option A. Presenting items one at a time and observing the client's approach, engagement, and duration of interaction with each item. Option B. Asking the client to verbally state their preference between two presented items. Option C. Presenting two items at a time and asking the client to point to their preferred item. Option D. Presenting multiple items simultaneously and observing which item the client touches first. The correct answer is A. Presenting items one at a time and observing the client's approach, engagement, and duration of interaction with each item. Explanation. Scenario analysis. This scenario presents a common challenge in behavior analysis, selecting the most appropriate preference assessment method when working with a client who has limited verbal communication. The professional must balance the need for accurate preference identification with the client's communication abilities and the practical constraints of the assessment environment. The challenge lies in ensuring the chosen method is both ethically sound and scientifically valid, leading to effective intervention planning. Correct approach analysis. The correct approach prioritizes a systematic and client-centered method that accounts for the client's communication limitations. A single stimulus preference assessment, where items are presented one at a time and the client's engagement is observed, is often a good starting point for individuals with limited verbal skills. This method is less demanding on the client's expressive abilities and allows for observation of approach behaviors, duration of engagement, and other observable responses. This aligns with ethical guidelines that mandate individualized assessment and intervention, ensuring that the client's needs and abilities are central to the process. It also adheres to the principle of using the least intrusive assessment necessary to gather meaningful data. Incorrect approaches analysis. Presenting multiple stimuli simultaneously without a clear method for the client to indicate preference, e.g., pointing, reaching, could be overwhelming and lead to inaccurate data, as the client may not be able to effectively discriminate or communicate their choice. This could be considered a failure to use an appropriate and individualized assessment strategy, potentially violating ethical standards that require assessments to be sensitive to the client's characteristics. Using a paired choice assessment when the client has significant difficulty with discrimination or indicating a choice between two items would also be inappropriate. This method relies on the client's ability to make a clear selection between two options, and if this ability is compromised, the data generated would be unreliable. This represents a failure to select an assessment that is valid for the individual client, potentially leading to ineffective interventions and a breach of professional responsibility. Conducting a verbal interview to determine preferences would be fundamentally flawed for a client with limited verbal communication. This approach ignores the client's communication deficits and would likely yield no meaningful data, thus failing to meet the requirement for a functional and appropriate assessment. This is a clear ethical lapse in assessment selection. Professional reasoning. Professionals should approach preference assessment by first considering the client's communication abilities, cognitive skills, and any sensory sensitivities. They should then review the available preference assessment methods and select the one that is most likely to yield reliable and valid data given the client's profile. If a client has limited verbal skills, starting with less demanding methods like single stimulus or observational assessments is often prudent. Data from these initial assessments can inform the selection of more complex methods if appropriate. The process should be iterative, with ongoing evaluation of the assessment's effectiveness and the client's engagement. Ethical guidelines and best practices emphasize individualized, data-driven decision-making throughout the assessment and intervention process. Question 13. Benchmark analysis indicates that a licensed behavior analyst is working with a client who exhibits frequent disruptive behaviors in a classroom setting. The behavior analyst has identified several environmental triggers that appear to precede these disruptive behaviors. The behavior analyst is considering implementing antecedent interventions, such as modifying the classroom layout to reduce visual distractions and increasing the frequency of teacher-delivered praise for on-task behavior. The client is a young child with limited verbal communication skills. What is the most ethically and professionally sound approach for the behavior analyst to take in implementing these antecedent interventions? Option A. Focus solely on increasing verbal prompts from the teacher to redirect the client's attention, as this directly addresses the immediate behavior without altering the environment. Option B. Implement the environmental modifications and prompting strategies without extensive data collection, assuming their effectiveness based on general principles of behavior analysis, and proceed with the intervention. Option C. Systematically implement environmental modifications and differential reinforcement of other behavior, while collecting data to assess their impact on reducing disruptive behaviors and increasing on-task engagement, and involve the client's parents in reviewing progress. Option D. Immediately implement a highly structured seating arrangement and a token economy system to reinforce compliance, as these are known to be effective in managing disruptive behavior in classroom settings. The correct answer is C. Systematically implement environmental modifications and differential reinforcement of other behavior, while collecting data to assess their impact on reducing disruptive behaviors and increasing on-task engagement, and involve the client's parents in reviewing progress. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for safety and skill acquisition with the ethical imperative to ensure client autonomy and informed consent, particularly when working with a vulnerable population. The behavior analyst must navigate the complexities of implementing antecedent interventions that are effective without being overly restrictive or undermining the client's developing independence. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and client-centered method for implementing antecedent interventions. This involves a thorough functional assessment to understand the function of the behavior, followed by the selection and implementation of antecedent strategies that are least restrictive while still being effective. The emphasis on ongoing data collection and evaluation ensures that interventions are responsive to the client's progress and needs, aligning with ethical principles of beneficence and non-maleficence. Furthermore, involving the client and their support system in the decision-making process, to the extent possible, upholds principles of respect for persons and promotes collaboration. This approach is consistent with the ethical guidelines for behavior analysts, which mandate the use of evidence-based practices and the consideration of client welfare in all interventions. An incorrect approach that relies solely on environmental manipulation, without a functional understanding of the behavior risks being ineffective or even counterproductive. This could lead to the implementation of overly restrictive antecedent strategies that limit the client's opportunities for learning and independence, potentially violating ethical principles related to promoting independence and avoiding unnecessary restrictions. Another incorrect approach that focuses on prompting without considering the client's ability to fade prompts or generalize skills may inadvertently create prompt dependency, hindering long-term progress and client autonomy. This would be a failure to adhere to the principle of promoting independence and self-sufficiency. A third incorrect approach that bypasses the client's or guardian's input in selecting antecedent interventions, even if seemingly effective, disregards the ethical requirement for informed consent and collaborative decision-making, potentially leading to a breakdown in trust and a failure to meet the client's broader needs and preferences. Professionals should employ a decision-making framework that begins with a comprehensive functional assessment to understand the antecedents and consequences maintaining the target behavior. This understanding then informs the selection of antecedent interventions, prioritizing those that are least restrictive and most likely to promote independence. The process should involve ongoing data collection to monitor effectiveness and client progress, with regular opportunities for review and adjustment of the intervention plan. Collaboration with the client and their support network is crucial throughout this process, ensuring that interventions are aligned with their goals and values. Question 14. To address the challenge of ensuring that behavior analytic services are not only technically sound, but also meaningful and acceptable to the client and their environment, a licensed behavior analyst, LBA, is working with a young adult client with autism spectrum disorder to increase independent community participation. The LBA has collected objective data showing a significant increase in the client's ability to navigate public transportation. However, the client expresses feeling anxious and overwhelmed during these outings, stating that the noise and crowds are too much. The LBA needs to determine the most appropriate next step to assess and address the social validity of the intervention. Option A. Focus exclusively on gathering feedback from the client's support group, as they are likely to have a broader perspective on the social acceptability of the client's participation in the community. Option B. Solely rely on the objective data demonstrating increased independent community participation, assuming that the client's anxiety is a separate issue unrelated to the intervention's effectiveness. Option C. Immediately discontinue the intervention and seek a new target behavior that the client expresses more enthusiasm for, without further investigation into the current intervention's social validity. Option D. Conduct a structured interview with the client and their primary caregiver to gather detailed feedback on the client's subjective experience of the intervention, including their comfort levels, perceived benefits, and any remaining challenges, while also reviewing the objective data on community participation. The correct answer is D. Conduct a structured interview with the client and their primary caregiver to gather detailed feedback on the client's subjective experience of the intervention, including their comfort levels, perceived benefits, and any remaining challenges, while also reviewing the objective data on community participation. Explanation. This scenario is professionally challenging because it requires the licensed behavior analyst, LBA, to balance the client's subjective experience of progress with objective data, while also ensuring that the interventions are socially acceptable and meaningful to the client and their stakeholders. The LBA must navigate potential discrepancies between what the data shows and what the client perceives as effective, necessitating a nuanced approach to social validity. The correct approach represents best professional practice because it directly engages the client and their significant others in evaluating the intervention's outcomes. This aligns with ethical principles of client-centered care and informed consent, ensuring that the intervention is not only technically sound, but also valued and accepted by those it affects. Specifically, seeking feedback on the importance of the target behavior, the acceptability of the intervention procedures, and the perceived effectiveness of the outcomes directly addresses the core tenets of social validity as defined by Kasdan and others, which are foundational to ethical and effective behavior analytic practice. This collaborative evaluation process ensures that the behavior analytic services are responsive to the client's needs and values, and that progress is defined in a way that is meaningful in their natural environment. An incorrect approach that relies solely on objective data without client input fails to acknowledge the subjective nature of social validity. This can lead to interventions that are technically effective but not perceived as useful or acceptable, potentially undermining client buy-in and long-term adherence. Ethically, this approach may violate principles of client autonomy and self-determination by imposing a definition of success that does not align with the client's lived experience. Another incorrect approach that focuses only on the client's stated satisfaction, without considering the objective data or the social significance of the target behavior, risks reinforcing superficial changes or interventions that are not truly addressing the functional needs of the client. This could lead to a misallocation of resources and a failure to achieve meaningful, lasting behavior change. It also fails to uphold the professional responsibility to ensure that interventions are based on empirical evidence and are designed to produce significant improvements in the client's life. A third incorrect approach that prioritizes the opinions of external stakeholders, e.g., school administrators, over the client's direct experience, without a balanced consideration of all perspectives, can lead to interventions that are not personally relevant or acceptable to the individual receiving services. While stakeholder input is important, the ultimate goal of behavior analytic services is to improve the client's quality of life, and their perspective on the social validity of the intervention is paramount. This approach risks alienating the client and undermining the therapeutic alliance. The professional decision-making process for similar situations should involve a systematic evaluation of social validity at multiple stages of intervention. This includes assessing the social importance of the target behavior before intervention, the social acceptability of the intervention procedures, and the social impact of the intervention outcomes. This evaluation should be a collaborative process involving the client, their significant others, and relevant stakeholders, using a combination of subjective feedback and objective data. The LBA must be prepared to adapt interventions based on this ongoing social validity assessment to ensure that services are both effective and meaningful. Question 15. Risk assessment procedures indicate that a family with a young child diagnosed with autism spectrum disorder is struggling with challenging behaviors at home, impacting family functioning. The parents have expressed a desire for support in managing these behaviors and promoting their child's development. As the licensed behavior analyst, LBA, what is the most appropriate initial step in developing a parent and caregiver training plan? Option A. Immediately present a standardized parent training curriculum that has demonstrated efficacy for children with similar diagnoses, assuming the parents will adapt to the program. Option B. Focus the training primarily on identifying and correcting parental deficits in behavior management techniques, framing the training as a necessary intervention to improve their parenting skills. Option C. Provide a detailed theoretical overview of applied behavior analysis principles and their application to autism spectrum disorder, expecting parents to extrapolate practical strategies from this information. Option D. Conduct a comprehensive assessment of the family's strengths, needs, goals, and cultural context, and collaboratively develop individualized training objectives and strategies with the parents. The correct answer is D. Conduct a comprehensive assessment of the family's strengths, needs, goals, and cultural context, and collaboratively develop individualized training objectives and strategies with the parents. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed behavior analyst, LBA, to navigate the delicate balance between providing effective parent and caregiver training and respecting the autonomy and cultural values of the family. The LBA must ensure that the training is evidence-based and promotes the child's development while also being sensitive to the family's unique circumstances, beliefs, and capacity to implement the strategies. Missteps can lead to decreased family engagement, mistrust, and ultimately, less effective outcomes for the child. Correct approach analysis. The correct approach emphasizes a collaborative and individualized process. It prioritizes understanding the family's specific needs, goals, and cultural context before designing and implementing training. This aligns with ethical principles of client-centered practice and respect for autonomy. By involving parents in goal setting and strategy selection, the LBA fosters buy-in and increases the likelihood of sustained implementation. This approach is also consistent with regulatory frameworks that mandate individualized service delivery and informed consent, ensuring that interventions are tailored to the unique needs of each family and child. The focus on practical, achievable strategies within the family's environment is crucial for generalization and long-term success. Incorrect approaches analysis. One incorrect approach involves immediately implementing a standardized, one-size-fits-all training program without assessing the family's unique needs, resources, or cultural background. This fails to respect the family's autonomy and can lead to the selection of strategies that are not feasible or culturally appropriate, thereby undermining the effectiveness of the training and potentially causing distress to the family. This approach violates ethical principles of individualized service and informed consent, and may contravene regulations requiring services to be responsive to the client's needs and preferences. Another incorrect approach is to solely focus on the child's deficits and present the training as a corrective measure for parental shortcomings. This can create a defensive and adversarial relationship with the parents, hindering collaboration and trust. It fails to acknowledge the parents as essential partners in the child's development and can lead to feelings of shame or inadequacy, which are counterproductive to effective training. Ethically, this approach is disrespectful and can damage the therapeutic alliance, and it may violate regulations that promote a supportive and collaborative relationship between providers and families. A third incorrect approach is to provide training that is overly theoretical and lacks practical, actionable steps that parents can implement in their daily routines. While theoretical understanding is important, The primary goal of parent training is to equip caregivers with skills to manage behavior and promote development. A lack of practical application makes the training ineffective and frustrating for parents. This approach neglects the core purpose of parent training and can be seen as a failure to provide competent and effective services, potentially violating ethical standards and regulatory expectations for service delivery. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough assessment of the family's strengths, needs, goals, and cultural context. This assessment should inform the development of a collaborative treatment plan that includes parent training. The LBA should then engage in ongoing communication with the family, actively seeking feedback and making adjustments to the training as needed. This iterative process ensures that the training remains relevant, effective, and respectful of the family's unique situation, aligning with both ethical best practices and regulatory requirements for competent and client-centered service provision. 16. The assessment process reveals that the prospective client is the sibling of a close personal friend with whom the licensed behavior analyst, LBA, has a long-standing and intimate relationship. The LBA has known the prospective client casually through this friend for several years. The LBA is concerned about how this pre-existing personal connection might influence their professional judgment during the assessment and subsequent treatment planning. Option A. Immediately disclose the personal relationship to the prospective client and discuss how it might impact the assessment. Then proceed with the assessment only if the client provides informed consent and the LBA feels confident in their ability to maintain objectivity, seeking consultation if any doubt remains. Option B. Proceed with the assessment as planned, assuming the professional relationship will be distinct from the personal one and that objectivity can be maintained without explicit discussion. Option C. Decline to conduct the assessment and immediately refer the prospective client to another qualified LBA without explaining the specific reason for the referral. Option D. Conduct a brief, informal assessment to gauge the client's needs and then decide whether to proceed with a formal assessment or refer them, without initially disclosing the personal connection. The correct answer is A. Immediately disclose the personal relationship to the prospective client and discuss how it might impact the assessment. Then proceed with the assessment only if the client provides informed consent and the LBA feels confident in their ability to maintain objectivity, seeking consultation if any doubt remains. Explanation. This scenario presents a professional challenge due to the potential for dual relationships and conflicts of interest, which can compromise the objectivity and effectiveness of behavioral services. The licensed behavior analyst, LBA, must navigate the ethical imperative to maintain professional boundaries while ensuring the client's best interests are paramount. The core of the challenge lies in balancing the need for comprehensive assessment with the avoidance of situations that could exploit the client or create a perception of impropriety. The correct approach represents best professional practice because it prioritizes the client's welfare and upholds the integrity of the profession. By immediately addressing the identified dual relationship and seeking consultation, the LBA demonstrates adherence to ethical codes that mandate avoiding conflicts of interest and seeking supervision when such situations arise. This proactive stance ensures that any potential biases are mitigated and that the client receives unbiased, high-quality services. It aligns with the principle of beneficence and non-maleficence, ensuring that the client is not harmed by the LBA's personal connections. An incorrect approach that involves proceeding with the assessment without disclosing or addressing the dual relationship is a significant ethical and regulatory failure. This violates the principle of informed consent, as the client is not aware of potential influences on the assessment. It also breaches the duty to avoid conflicts of interest, as the LBA's personal relationship could unconsciously or consciously affect their professional judgment, leading to an inaccurate or biased assessment. Furthermore, it fails to uphold the standard of care expected of an LBA, which includes maintaining professional boundaries. Another incorrect approach, such as terminating services abruptly without proper referral or explanation, could also be problematic. While it attempts to distance the LBA from the conflict, it may not be in the client's best interest if it leaves them without appropriate support or a smooth transition of care. Ethical practice requires a thoughtful and client-centered approach to service termination, especially when initiated due to a conflict of interest. The professional decision-making process for similar situations should involve a systematic evaluation of potential conflicts. This includes identifying any existing or potential dual relationships, assessing the risk of harm or compromised objectivity, consulting relevant ethical codes and regulations, seeking supervision or consultation from peers or supervisors, and developing a plan to mitigate or eliminate the conflict while prioritizing client welfare. Transparency and open communication with the client are crucial throughout this process. Question 17. Stakeholder feedback indicates that the client's family is eager to see clear, measurable progress in the target behavior and is concerned about the potential for any setbacks. The behavior analyst has identified a target behavior that is expected to change gradually with intervention. Considering the need to demonstrate experimental control while minimizing the risk of regression and ensuring continuous improvement, which single-subject research design would be most appropriate to implement? Option A, a multiple baseline design across behaviors where the intervention is introduced to different behaviors sequentially. Option B, an ABAB reversal design where the intervention is withdrawn and reintroduced multiple times. Option C, a changing criterion design where performance criteria are systematically increased as the client demonstrates mastery. Option D, a concurrent multiple baseline design across settings, where the intervention is applied to the same behavior in different settings at different times. The correct answer is C, a changing criterion design, where performance criteria are systematically increased as the client demonstrates mastery. Explanation. This scenario presents a professional challenge because it requires balancing the need for rigorous research to demonstrate intervention effectiveness with the ethical imperative to provide the best possible care to individuals. The client's family is understandably concerned about progress and wants to see clear evidence of change, while the behavior analyst must adhere to ethical standards for research and practice. The decision of which single-subject research design to employ is critical for both scientific validity and client welfare. The correct approach, utilizing a changing criterion design, represents best professional practice because it allows for the systematic introduction of performance criteria that gradually increase or decrease. This design is particularly well-suited for situations where gradual behavior change is expected or desired, and it allows for the demonstration of experimental control by showing that the behavior changes only when the criterion changes. This aligns with ethical guidelines that mandate the use of research designs that can demonstrate functional relationships between the intervention and the behavior, while also being sensitive to the client's ongoing progress and the need for continuous improvement. The gradual nature of the criterion change can also be less disruptive to the client and their environment compared to abrupt withdrawal of treatment. An incorrect approach would be to solely implement an ABAB design without considering the potential for withdrawal of treatment to negatively impact the client. In many cases, withdrawing an effective intervention, the B phase, to return to baseline, the A phase can be ethically problematic if it leads to a significant deterioration in the client's behavior or well-being. This could violate ethical principles related to beneficence and non-maleficence, as it may cause harm or a loss of progress. Another incorrect approach would be to use a multiple baseline design across behaviors if the behaviors are not functionally independent, or if the implementation of multiple baselines across settings or participants would be logistically unfeasible or ethically burdensome without clear justification. This could lead to an inability to demonstrate experimental control if changes in one behavior or setting are confounded by changes in another, and could also be inefficient and resource-intensive. The professional decision-making process for similar situations should involve a thorough assessment of the client's needs, the target behavior, and the potential impact of different research designs. The behavior analyst must consider the ethical implications of each design, particularly regarding the potential for harm or loss of progress. Consultation with supervisors, colleagues, and potentially the client's family is crucial to ensure that the chosen design is both scientifically sound and ethically responsible. The decision should prioritize the client's welfare while striving for the highest standards of research integrity. Question 18. Consider a scenario where a parent of a young child with autism spectrum disorder (ASD) approaches a licensed behavior analyst (LBA), requesting immediate implementation of a specific visual schedule intervention they read about online, believing it will solve all their child's behavioral challenges. The parent expresses frustration with the child's current difficulties with transitions and insists on starting the visual schedule immediately, even before any formal assessment has been conducted by the LBA. What is the most ethically and regulatorily sound course of action for the LBA? Option A. Agree to implement the visual schedule intervention as requested by the parent, as client preference is a key factor in treatment adherence. Option B. Recommend that the parent research other potential interventions online and select one that they feel is most appropriate, as the LBA's role is to support the parent's choices. Option C. Explain to the parent the importance of a comprehensive functional behavior assessment, FBA, to understand the specific function of the child's transition difficulties before designing an intervention, and propose a timeline for assessment and subsequent intervention planning. Option D. Suggest a trial period of the visual schedule intervention for a week, and if it shows no immediate improvement, then proceed with a formal assessment. The correct answer is C. Explain to the parent the importance of a comprehensive functional behavior assessment, FBA, to understand the specific function of the child's transition difficulties before designing an intervention, and propose a timeline for assessment and subsequent intervention planning. Explanation. This scenario presents a professional challenge because the behavior analyst must balance the client's immediate needs and preferences with the ethical and regulatory imperative to conduct a thorough and objective assessment. The client's expressed desire for a specific intervention, without a prior comprehensive assessment, risks leading to an ineffective or even harmful treatment plan. The behavior analyst's primary responsibility is to ensure the client receives services that are evidence-based and tailored to their unique needs, which necessitates a robust assessment process. The correct approach represents best professional practice because it prioritizes a systematic and data-driven understanding of the target behavior and its controlling variables before recommending or implementing any intervention. This aligns with the core principles of applied behavior analysis and the ethical guidelines that mandate assessment before intervention. Specifically, regulatory frameworks for licensed behavior analysts, LBA, emphasize the importance of conducting functional assessments to identify the antecedents and consequences maintaining problem behaviors. This ensures that interventions are precisely targeted, increasing the likelihood of positive outcomes and minimizing the risk of unintended consequences. This approach upholds the client's right to effective treatment and the professional's duty of care. An incorrect approach that proceeds directly to intervention without a functional assessment fails to meet the ethical standard of competence and due diligence, may violate regulatory requirements that mandate assessment as a prerequisite for treatment planning. This approach risks applying an intervention that is not aligned with the function of the behavior, leading to wasted resources, client frustration, and potentially the escalation of the problem behavior. Another incorrect approach, such as relying solely on anecdotal information or the client's stated preferences without objective data collection, also falls short. While client preferences are important, they cannot substitute for a systematic behavioral assessment. This can lead to misinterpretations of the behavior's function and the selection of inappropriate interventions, violating the principle of providing services based on scientific evidence. A professional decision-making process in such situations should involve a clear hierarchy of steps. First, conduct a comprehensive assessment to understand the behavior. Second, analyze the assessment data to identify the function of the behavior. Third, develop an intervention plan based on the assessment findings and evidence-based practices. And finally, continuously monitor and evaluate the effectiveness of the intervention, making adjustments as needed. This systematic process ensures that interventions are ethical, effective, and client-centered. Question 19. The investigation demonstrates a scenario where a licensed behavior analyst, LBA, is tasked with understanding a client's disruptive classroom behavior. The LBA observes the behavior and notes that it often occurs when the teacher asks the client to complete a worksheet. The LBA also notes that the disruptive behavior sometimes results in the client being sent out of the classroom, which the client appears to enjoy. Which of the following approaches best reflects a comprehensive ABC analysis for this situation? Option A. Focus solely on the disruptive behavior itself, documenting its frequency and intensity, and recommend strategies to suppress the behavior directly. Option B. Assume the behavior is a learned response to academic difficulty and recommend providing more simplified academic tasks without further investigation into specific antecedents or consequences. Option C. Systematically record the specific antecedent events, e.g., teacher's verbal request, proximity of teacher, specific worksheet content, the precise topography of the disruptive behavior, e.g., yelling, throwing materials, and the immediate consequences, e.g., teacher reprimand, peer attention, escape from task, access to preferred activity outside the classroom. Option D. Conclude that the behavior is attention-seeking because the client enjoys being sent out of the classroom, and develop an intervention focused on increasing positive attention. Correct answer is C. Systematically record the specific antecedent events, e.g., teacher's verbal request, proximity of teacher, specific worksheet content, the precise topography of the disruptive behavior, e.g., yelling, throwing materials, and the immediate consequences, e.g., teacher reprimand, peer attention, escape from task, access to preferred activity outside the classroom. Explanation. The investigation demonstrates a common challenge in applied behavior analysis, accurately and comprehensively capturing the functional relationships between environmental events and behavior. The professional challenge lies in moving beyond simple observation to a systematic analysis that informs effective intervention. This requires careful judgment to ensure that the chosen method of ABC analysis is both scientifically sound and ethically aligned with professional standards and regulatory requirements for licensed behavior analysts, LBA. The correct approach represents best professional practice because it prioritizes a systematic and data-driven method for understanding behavior. By collecting detailed information on antecedents and consequences, the behavior analyst can formulate a hypothesis about the function of the behavior. This aligns with the ethical obligation to provide evidence-based services and to practice within the scope of professional competence, as mandated by regulatory bodies governing LBAs. A thorough ABC analysis is foundational to developing effective behavior intervention plans that are tailored to the individual's needs and the specific environmental context. An incorrect approach that relies solely on anecdotal observation or subjective interpretation fails to meet the rigor expected of an LBA. This could lead to interventions that are ineffective or even harmful, as they are not based on a clear understanding of the behavior's function. Such an approach may violate ethical principles related to competence and the obligation to use scientifically validated procedures. Furthermore, it may not meet the standards set by regulatory frameworks that require data-driven decision-making and the systematic assessment of behavior. Another incorrect approach might involve focusing exclusively on the behavior itself without adequately considering the antecedent and consequence variables. This overlooks the core principle of functional behavior assessment, which posits that behavior is influenced by its environment. An LBA has a professional and ethical responsibility to investigate the environmental variables that occasion and maintain behavior. Failing to do so represents a significant gap in professional practice and may contravene regulatory expectations for comprehensive functional assessments. The professional decision-making process for similar situations should involve a systematic evaluation of the available information, a clear understanding of the principles of behavior analysis, and adherence to ethical codes and regulatory guidelines. Professionals should always strive to employ methods that are objective, reliable, and valid. When faced with complex behavioral scenarios, it is crucial to consult relevant literature, seek supervision or consultation when necessary, and prioritize the client's well-being and progress through evidence-based practices. Question 20. Upon reviewing the progress of a client with severe self-injurious behavior, a behavior analyst observes that positive reinforcement strategies for alternative behaviors and antecedent modifications have not yielded sufficient reduction in the frequency and intensity of the self-injury. The behavior analyst is considering the implementation of a punishment procedure. Which of the following represents the most ethically and regulatorily sound next step? Option A. Conduct a thorough review of the functional assessment data to ensure all possible antecedent and consequence-based positive interventions have been exhausted, and if so, select the least restrictive, ethically justifiable punishment procedure supported by empirical evidence, ensuring all necessary consents and oversight are in place. Option B. Immediately implement a timeout from positive reinforcement procedure, as this is a commonly used punishment procedure that has shown effectiveness in reducing challenging behaviors. Option C. Introduce a verbal reprimand contingent on the self-injurious behavior, as this is a mild form of punishment that is unlikely to cause significant harm. Option D. Consult with a colleague to discuss the possibility of using a more severe punishment procedure, such as a brief physical intervention, given the dangerous nature of the self-injurious behavior. Correct answer is A. Conduct a thorough review of the functional assessment data to ensure all possible antecedent and consequence-based positive interventions have been exhausted, and if so, select the least restrictive, ethically justifiable punishment procedure supported by empirical evidence, ensuring all necessary consents and oversight are in place. Explanation. This scenario presents a professional challenge because it involves the application of punishment procedures, which are ethically sensitive and require strict adherence to regulatory guidelines to ensure client welfare and prevent harm. The behavior analyst must balance the need to reduce a dangerous behavior with the ethical imperative to use the least restrictive intervention necessary, and to ensure that any intervention is implemented humanely and effectively. The decision-making process requires careful consideration of the severity of the behavior, the availability of alternative interventions, and the potential for negative side effects. The correct approach represents best professional practice because it prioritizes the client's safety and well-being by first exploring and implementing less restrictive, positive behavior support strategies. This aligns with the ethical principles of beneficence and non-maleficence, as well as the regulatory requirement to use interventions that are evidence-based and least likely to cause harm. Documenting the rationale for choosing specific interventions and continuously monitoring their effectiveness and impact on the client's quality of life are also critical components of ethical and regulatory compliance. An incorrect approach that involves immediately implementing a punishment procedure without a thorough functional assessment or consideration of positive alternatives fails to meet the ethical standard of using the least restrictive intervention. This could lead to the development of new problem behaviors, emotional distress for the client, and a breakdown in the therapeutic relationship. Furthermore, implementing punishment without a clear, data-driven rationale and without appropriate oversight or consent from guardians, where applicable, violates regulatory requirements for responsible practice and client protection. Another incorrect approach might involve the use of a punishment procedure that is overly intrusive or aversive, even if it is technically a recognized punishment procedure. This would be a failure to consider the proportionality of the intervention to the behavior and could result in significant harm, violating ethical principles and potentially specific regulations regarding humane treatment. Professionals should employ a systematic decision-making process that begins with a comprehensive functional assessment to understand the variables maintaining the target behavior. This assessment should inform the development of a behavior intervention plan that prioritizes positive reinforcement and antecedent strategies. If punishment procedures are deemed necessary, they should only be considered after less restrictive alternatives have been attempted and proven ineffective, and they must be the least restrictive form of punishment that is likely to be effective. All interventions, especially punishment, must be implemented with strict adherence to ethical guidelines and regulatory requirements, including obtaining informed consent, ensuring adequate training for implementers, and continuous data collection to monitor effectiveness and any adverse effects.